it's mainly like there's 2 questions here, 4 questions here, but it kind of can give a little bit of an idea of which chapters are a little more heavily covered. And then I also have a final review Prezi presentation. So you can go through that and also use that as a way to study some of the content. It's mainly normal antepartum, normal labor, normal postpartum. It does have a little bit of newborn on there, but not much since there's another Prezi review that's newborn oriented. And then I also tried to put all of the resources that we've used throughout the semester kind of in one place for you. So the different practice and simulation games and escape rooms and all of those different kinds of things. I kind of tried to put them here in all in one place for you so that if you want to use those, go back, and if you haven't used them already, you can use them to help you study for the final. If you've used them, it'd be good still just to go back and review them again. So I've kind of tried to give you several different kind of resources to go and look for or look at as you review for the final. So stop this for a second. As I stated, I'm not going to record this final review. And the main reason for that is because what I'm using, it doesn't belong to me. I got permission from somebody to use it. And so I just don't want it to be out there where it's been recorded and could possibly be passed along to other people since it doesn't belong to me. So it's a maternity escape room that somebody created. It does a pretty good job of kind of going through all the different areas of content that we've talked about through this semester. Okay, so hopefully, okay, so are we up for the challenge? Yes. All right, I just want to make sure. Hopefully on Zoom, if that did not change pages on Zoom, please let me know. Not seeing any chats. Okay, so this is an example first of how it works. So each room will have questions or activities that we have to complete. And then in order to move to the next room, we have to answer the questions correctly. And to unlock the door, we have to put in the correct number. So the number that we put in will correspond to the correct answer on the question. So I'll need somebody to kind of keep track of the code for me. Anyone want to volunteer to do that? Rachel, thank you. All right, so just as an example, so what is Disney's famous female mouse's first name? Minnie. So the first number of our code will be 2. Where is she from? Disney. So then 1. And then who does Minnie hang out with? Mickey. So then 3. All right. So then we're going to enter the code to unlock the door. So that'll be, what was it? 213. Okay. Yay. All right, am I pregnant? So we're going to answer the questions about prenatal care and pregnancy to move into the next room. Okay, so we have Brenda. She's here in the clinic because she's been increasingly fatigued and is nauseous. She says her period is 5 days late. You understand that Brenda is exhibiting which classification of pregnancy-related symptoms? Presumptive, positive, probable, or unable to determine? Everybody agree, presumptive? Okay. Brenda is excited and frightened. She wants to be absolutely sure she is pregnant before she announces her pregnancy. What is the most reliable way to be positive at this time? Order a blood draw to look for the presence of HCG, order an ultrasound, collect urine to test for HCG, or order a CAT scan to assess for the presence of a uterine tumor. 2? Why 2? Yeah, because we can visually see it. So what are the 3 ways that we know for positive that we have a pregnancy? We can visualize it. Mm-hmm. We can feel it. Yep. What else? You can hear it. Yeah. Order an ultrasound because then we'll actually be able to visualize that there's a baby there. So you know that Brenda wasn't expecting to get pregnant, so she wasn't taking prenatal vitamins. When teaching Brenda about the health of her unborn child, which nutrient will you encourage her to get to prevent neural tube defects? Folic acid. While assessing Brenda's reproductive health history, she tells you that she had a baby when she was 18 years old that she gave up for adoption. She was afraid to care for the baby since it was born at 27 weeks and needed a lot of care. She also had a pregnancy that ended in abortion at 10 weeks when she was 20 years old. How will you document Brenda's reproductive health? So her to 2. So how many pregnancies is this for her? It's her 3rd. Has she had any term pregnancies? Yep, so that pretty much only falls under 2 then. And she had 1 preterm at 27 weeks, had an abortion at 10 weeks, and then she has the 1 living child. Even though she gave that child up for adoption, it's still counted under the living children.
Wait, I only count 2.
If Brenda is concerned about eating properly and wants to know how to ensure the baby is getting enough nutrients to grow, you will tell Brenda which of the following. We didn't really cover this, but just kind of give your best guess. You will need to consume approximately 550 kcals more per day. You can just maintain your current diet because you're a healthy weight. It's best to increase your calories by 300 kcals more than your pre-pregnancy needs, or you should eat 120 kcals less to prevent gestational diabetes. What do you guys just... I believe that is correct. Brenda is nervous about the well-being of her baby and wants to know when she will start feeling the movement. Your most appropriate response to her will be 12 weeks, 16 weeks, 27 weeks, or 20 weeks. Four. All right, let's see. So what's our code? You have to say it slowly.
1,
Okay.
2, 3, 4.
Yay. Okay. Okay, so there's some chat in the chat room about her being a G2 versus G3. So she's there. We're kind of making that assumption since she's there and she's had a positive pregnancy test, and we're kind of going through this as if she is pregnant. So that's why we're saying she's a G3 versus a G2. So we're counting that current pregnancy plus the one that she had preterm and then the abortion. Does that kind of help clarify things for that? I'm not seeing anybody say yes or no in the chat, so. All right, is it time? So Brenda's come to the OB triage because she believes she is in labor. She's now 37 weeks gestation. What does she have going on her belly right there? I remember what that is.
Testing 1, 2.
Linea
Testing
nigra.
1, 2.
Yep. Okay. Working. Okay, she reports feeling tightness in her belly. She thinks they are labor contractions. What statement by Brenda would best indicate that she is having false labor? Remember what our difference is between true and false labor. So get up and walk because it feels better when we move. So they get better with movement.
We can't hear what the students in class are saying.
Let's see. Yep, and everybody on Zoom is agreeing with that. All right, so she's admitted. I can't keep these all up at the same time. I wish I could. For observation, placed on a fetal heart monitor and Toco nanometer to monitor her contractions. She asks you what her baby's heart rate is. Looking at the strip, you know that her baby has a baseline heart rate of. Okay, so let me see if I can. So we got 60, 90, 120, 150, 190. So, or is that 160? I can't tell. 90. Yeah, looks like they go up by threes. Let's see what are. Can you repeat what the students are saying in class or can't hear them? All right, so let's see what our options are. 120, 110, 145, and 160. All right, so we're guessing in the classroom 145. I guess I'll say we're not guessing, we're making an educated choice. She asks you if this is a normal fetal heart rate, and you respond, yes, it's concerning because it's slow, it's too high, or the strip doesn't give me enough information. So what's normal fetal heart rate? Normal, yes, this is a normal fetal heart rate because normal is, what'd you say? 110 to 160, yes. 2 hours later, you're checking the fetal heart monitor on Brenda and see the following reading. You know that what you are seeing is variable decelerations, early decelerations, late decelerations, or fetal bradycardia. No, it's right around 120 right now. So what do these look like here? So what do variable decelerations look like? Yeah, so variable decelerations are the ones that have a very abrupt down and back up rather than the gradual. So these are more, you say these are more gradual or more abrupt? More gradual. Okay, so we can say they're not variable. Early decelerations, what do those look like? Yeah, so early decelerations happen, they mirror the contractions. So they go down at the same time the contraction starts and then comes back up and recovers at the same time that the contraction is over. And then late decelerations after the contractions start, yeah. So they're shifted a little bit to the right. So do you say these are early or late? Okay. Yeah, they look, this one, oh, yeah, because it's kind of starting right at the top of the contraction. Based on your assessment of the monitoring strip, you do the following. So what do late decelerations tell us? Something with the placenta, yeah.
Obstruction or compression? I know it's.
Nope.
Yeah.
Hmm? It had something to do with the perfusion, yeah. Placental insufficiency. So what does that mean?
Not enough oxygen.
We're not getting enough oxygen, exactly. So what are we gonna do? We're gonna get her some ice chips, put her on oxygen, and put her on her side, get her out of bed for a shower, or put her in the lithotomy position and prepare for delivery. Let's see, yes, FIBA, placental insufficiency in number 2. Thank you, FIBA. All right, so we order, the nurse gets orders for tuberculin, 0.25 milligrams sub-Q once, then discontinue. They receive the following from pharmacy. How many mils will you administer? So we're wanting to give 0.25 milligrams. It comes as 1 milligram in 1 mil. So how many mils are we going to give? I'm going to give 3. We're not going to give 3. We're going to give number 3, 0.25 mils. Based on the information above, you discover that Brenda is experiencing, so we've kind of already answered that one. Yes, uteroplacental insufficiency. We're going to enter the code to unlock the door to the mother baby unit.
1, 3, 2, 3, 1.
Okay. Yay! All right, so after a scary delivery, Brenda has delivered a 7-pound, 4-ounce baby boy 30 minutes ago, and he had to go to the NICU for observation. She's recovering in labor and delivery before being transferred to the mother baby unit. Oh, cute baby. Which of the following assessment findings would pose the greatest risk to Brenda right now? Foul smelling discharge and a fever, soaking 3 pads in the last 20 minutes, unable to urinate now that her Foley is out, or episiotomy pain and swelling of her perineal area. I think 2. Why do you think 2 over 1?
Because it's the most urgent. She could be bleeding out, whereas like infection, you could treat it with antibiotics. And the fluid, electrolytes balance.
So which one's going to make her go downhill fastest, right? So number 2, soaking 3 pads in the last 20 minutes tells us that she's probably hemorrhaging. Yeah, FIBA says postpartum hemorrhage will kill her faster. Exactly. So these types of questions you guys have a lot of, when we talk about priority, or we talk about what would we do first, that's what we want to think about, is which one's going to make her go downhill fastest or kill her fastest. And so that's going to be the one that we want to address immediately. So hemorrhaging would be the priority right now. Says the following day, Brenda has been wheeled back to the mother baby unit after visiting her son Tyler in the NICU. You do your fundal assessment on Brenda, and she asks what you're looking for. What is your response? Your uterus should be 1 centimeter above your belly button. I'm should be able to feel your uterus centered and 3 centimeters below your belly button and firm. I should be able to feel the top of your uterus 1 centimeter below your belly button, and it should be firm. I should not be able to feel your uterus anymore. 3. Okay. And why do you say number 3?
Because it moves balance and centimeter per day. And it starts at the umbilicus after birth, and then it goes down.
Exactly. Yeah. So after delivery and about 12 hours, it should be even with the level of the umbilicus, and then it should move down 1 centimeter per postpartum day. Now, some women involute a lot faster than that, but that is the rate at which they should be at a minimum. Upon palpation, you notice her fundus is more to the right side of her abdomen and is soft. You know that this is likely due to the fact that she was sitting up in a wheelchair for an hour. Normal for 1 day post delivery, because she just got back and hasn't emptied her bladder, or because she's constipated. Yeah, so remember, a lot of times when we have that deviation, it's first thing we look at is last time she voided. Yep. Brenda has been working on pumping her breast milk to send to the NICU for Tyler. She calls you to the bedside and complains of pain to her left breast. On assessment, you note a warm reddened area just behind the areola. You know that Brenda is likely suffering from endometritis, normal engorgement pain because her supply is coming in, thrush, or mastitis. Mastitis, okay. All right, what's our code, Rachel?
2334.
Yay! Oh, baby. Tyler's still in the NICU, but overall doing well and preparing for discharge. Why do you guys think he might have gone to the NICU? It didn't really say. Maybe RDS, yeah. What was going on before he delivered? What was on that strip? We had the late deceleration, so baby wasn't getting enough oxygen. So maybe, I don't know. It doesn't really give us enough info, but so you deliver 2 bottles of breast milk. And when you arrive, the nurse is assessing Tyler. Oops. I'm trying to keep up with the chat too. Are these type of questions similar to what will be on the final? They are similar in terms of the content. And some of these are written NCLEX style and some of these are not written NCLEX style. So yes and no. But the content is similar to what's going to be on your final. So you deliver 2 bottles of breast milk for Tyler to the NICU. When you arrive, the nurse is assessing Tyler. You're watching a note that the nurse has documented the following: the temp of 97.6 degrees Fahrenheit, heart rate of 158, respirations of 52, and CBG, which is blood glucose, of 42. Which of the following is most concerning? Capillary blood glucose of 42. What do we like for it to be? Yeah. And part of that, remember, depends on the day. So you'll want to review that in that chart because day 1 is a little bit different from days 2 through 5. Nope, not 2, 3. Based on the findings above, how might Tyler be presenting? Belly breathing and sleepy, mottled skin and calm, high-pitched cry and quivering, or sucking on his bottle and gulping and stops frequently and whimpers. 3.
But do they quiver? They don't quiver. I thought they did tremors with
Yeah, they can have some like jitteriness and stuff, especially okay. FIBA says 3. Do we want to trust FIBA? Okay. All right. You discussed Tyler's condition with the NICU nurse before returning to the mother baby unit and determined that the findings were likely due to cold stress. Because he recently had his first bath and the warmer wasn't working. The breast milk doesn't have enough glucose. He received his vitamin K injection, or he has an elevated bilirubin. So you bring Brenda back for his next feeding so she can attempt to breastfeed him. She puts him to the breast and you determine that she needs more teaching when you notice that Tyler latches how. We didn't really talk about this, but we want their mouth to be completely covering the nipple and the areola area. We don't want it to be just, we kind of talked about it a little bit when we talked about looking for cracks and blisters and stuff in the on the breast, but we want it to be wide mouthed and have that whole area in their mouth when they're, and then we want their tongue down. So let's see. Carrie Ann says 2. Whoops. keeps clicking us now, right? So accidentally. All right, so wide mouth with his mouth just on the nipple tip, with his tongue down underneath the areola, or with his mouth over the nipple tip and part of the areola. I think two. So we want it just, so if it's just on the nipple tip, he's just sucking on the nipple, and that's gonna cause a lot of issues with, so needs more teaching. Gotcha. You guys are on the ball more than I am. Yep. So we want it to be wide mouthed, want the tongue to be down. We want it to be over the nipple and the areola. So if it's just on the nipple tip, then we can have problems. All right, Brenda and Tyler are preparing for discharge home. As Brenda is getting Tyler dressed, she asks you why he has a yellow tone to his skin. Your response should be, it's from the soap, it's a normal reaction from the vitamin K injection, it's mild jaundice, or it's antibodies in your breast milk. Three. Okay. All right. No, you're fine.
3, 1, 2, 3.
Yay! We've successfully helped Brenda and Tyler to reach discharge, and they can now go home and begin their new life together. You've also just reviewed for your final exam. And we're not gonna do that. Okay. There. All right, so the final thing that I have for you guys today is I'm going to give you the content areas for each chapter that you need to focus on for the final. So rather than have you guys study everything that we've covered for the semester, I'm going to help you kind of narrow down your studying a little bit. Now, not everything that I tell you to study is going to be on the exam, but everything on the exam will come from this content. Does that make sense? Okay. All right, so for chapter 6, which is the maternal adaptations to pregnancy, you need to review the cardiovascular system, your signs of pregnancy, so that presumptive, probable, and positive signs of pregnancy. The gastrointestinal system, and the integumentary system. For chapter 7, the antepartum assessment, care, and education. You review how to do the obstetrical history, so the GTPAL. Nagel's rule, so that's your estimated, how we figure out the estimated due date. So subtract 3, add 7, that one. And then the common discomforts of pregnancy, specifically nausea and vomiting, heartburn, and backache. Okay, for chapter 8, nutrition for childbearing, I want you to review the vitamins and minerals, the iron and folic acid. Weight gain. Remember knowing what BMIs fall under normal range, overweight, underweight, and then the formula that I gave you for how much weight gain they should be overall. So how much in the first trimester and then how much in the second and third trimester. Good sources of protein. and the food precautions. For chapter 10, complications of pregnancy. Need to know the difference between placental abruption and placenta previa, and the signs and symptoms and the interventions for each of those. To review ectopic pregnancy. Preeclampsia, including the magnesium sulfate. And group B strep. For chapter 14, the intrapartum fetal surveillance, internal versus external monitoring. Your nursing actions for early, late, and variable decelerations. And nursing actions for early, late, and variable decelerations. Causes of fetal tachycardia and bradycardia. And then assessment of contractions, so knowing how to assess the duration, the frequency, and the intensity. Chapter 9, assessing the fetus. You know the reasons why we do a first trimester ultrasound, and then the reason versus the reasons why we do a second and third trimester ultrasound. Review your non-stress test. And review the biophysical profile. Under chapter 12, the processes of birth, review the stages and phases of labor. So what makes this something stage 1, stage 2? When are we in active phase of stage 1? Those kinds of things. Just what those criteria are. The difference between true and false labor. And then the components of the birth process, the passenger, so we're the fetal, like the fetal lie, the fetal position, fetal presentation, all those different things related to the baby. Chapter 15, the nursing care during labor and birth. Due to review oxytocin induction. So why would they do what does that mean to induce oxytocin? When we would turn the oxytocin up, when we turn it down. Review amniotomy. Review operative vaginal birth of forceps. So what's the criteria for using forceps? What do we have to watch for and be careful about? What are some things that can happen when we use forceps? And then for the APGAR score, knowing just like what do we do if they score a certain number? What are the interventions for those different scores?
You mentioned the forceps, are we also gonna cover the vacuum?
No, just the forceps. Chapter 13, pain management. I want you to review epidural management. Cutaneous stimulation. And then systemic drugs for labor. Those are your opioid analgesics. So what are our precautions for those and how do we administer them safely? Chapter 16, intrapartum complications, review triple I, the intrauterine inflammation and infection. How do we assess for and what do we do if we have a prolapsed cord? And then signs and symptoms of preterm labor and the medications that are used for preterm labor. Chapter 17, postpartum adaptations in nursing. I want you to review uterine involution. Just like we talked about in the escape room, what do we expect and where should that uterus be when we're assessing it? Comfort measures for episiotomies or laceration. How to assess lochia. And then those maternal adaptation phases, the taking in, taking hold, and letting go phases. Chapter 18, postpartum maternal complications, interventions for postpartum hemorrhage. Quantifying blood loss. Interventions for a superficial venous thrombosis, SVT. And mastitis. For chapter 19, the normal newborn processes of adaptation, we review the methods of heat loss, the gastrointestinal system, and the hepatic system. So specifically the bilirubin and the glucose stuff. For chapter 20, assessment of the normal newborn, what's normal weight loss in the newborn? Head assessment, specifically the molding and the caput and cephalohematoma, those different things that can happen. And what's the difference and when do we see those different things? The reflexes. And skin assessment. Chapter 21, care of the normal newborn. Review vitamin K, why we give it, when we give it. Cord care. Safe sleep. And circumcision care.
What was the last one?
Circumcision care. And chapter 23 and 24, the high-risk newborn thermoregulation for the preterm infant. Problems with pain. Meconium aspiration syndrome. And phototherapy. Chapter 25, family planning. We want to review tubal ligation. IUD, both as just a birth control option and as an emergency contraceptive. The vaginal sponge. Actually, that's it. Because I already said emergency contraceptive. And then chapter 27, women's health, premenstrual syndrome. Endometriosis. And then chlamydia and HPV. And then the chapter 54, the male reproductive, review the drug therapy for benign prostate hyperplasia. Continuous irrigation after the TERP procedure. And home catheter care following a prostatectomy. And that's it. Does anybody need me to repeat anything? Okay. Any questions? Okay. Well, if anything comes up or if you think of anything, of course, always email me or you can Zoom meeting with me anytime this week and I'd be happy to help you guys out. Otherwise, I'll see you guys next week. Some of you I'll see on Thursday. The rest of you I'll see next week. Oh, yes, sorry. Thank you. Actually, the final, thank you for bringing that up. The final is at 10 a.m. It's a different time, but it is in this room. Thank you, Rachel. But it's still on Monday. Yes, Monday at 10 a.m. So it just starts a little bit later. Outside of what I just gave you, right?